Hi everyone, Dr. Sonia Anderson here from Cornerstone Physical Therapy, here to talk a little bit about posture and your jaw. Before I get too far ahead, I just want to point out that you should check out our Facebook page. We have a ton of really informative, informational videos online, on Facebook, I think maybe on YouTube as well, so check it out. But like I said, today I'm going to talk about the jaw and your posture. I think this is super important right now because we have had a ton of patients who in this past year have completely changed their day-to-day routine, whether they're at home more working, or maybe they're more in the car, or maybe they're helping their kids out with virtual classroom. And of course, wearing a mask. That all affects our posture and affects our jaw for sure. So our posture is super important. You've been hearing it all the time from your grandparents probably. That's what most people think of. It is important. They are onto something there. So when we are in a nice kind of tall position, and when I say nice tall position, I mean that sternum's kind of facing up and forward versus kind of facing down. I'll turn to the side so you can see too. So kind of facing up in an angle almost versus facing like that. I mean, look what happens to my neck here. Look at that. That's terrible, right? Obviously, this feels a lot better, especially long term. So that's what I mean by nice up and tall posture. Also, making sure your face is kind of level versus being in this kind of forward position. A lot of times I tell my patients, instead of leading with your chin, kind of lead with your forehead. So I'll show you again from the side. So leading with your chin kind of looks like that. Obviously, you can tell somebody would have neck pain being in that position for a long time. So leading with your chin looks like this. Leading with your forehead looks kind of more like this. Isn't that a nice position? I got a little bit going on here, but that's okay. So that being said, we're going to talk about how those different positions affect your jaw position. Now, when we are in this nice tall posture, this is the mandible, this bone here. The top of this mandible fits into what you would call the socket for the joint, or maybe the joint capsule. And it's in this nice kind of neutral position. Now, if I kind of bite my teeth together lightly, I should feel what a dentist would consider like my ultimate, my optimum position for something like chewing. Now, I'm not saying that because you should be always clenching your teeth or your teeth should always be touching. In fact, they should never be touching. But that is a nice way for us to kind of feel how those teeth are kind of matching up when we're chewing something. So when we're in this nice position, I'm going to have everybody try it. You should feel some pretty good contact, even on both sides, kind of almost in the canines, like in the kind of the middle range of your teeth, not forward, not in the back, in other words. Now, that's what it feels like here for me. If I go into, let's say, a position where I'm looking down for a lot of the time, so maybe if I'm on my phone a lot and I'm looking down, or if I've got my computer on my laptop and I'm looking down. So I'll show you from the side again, kind of more like this position. When I bring my teeth together in that position, almost the only teeth that touch are very at the front. So my bite is already off just because of that. So let's say I'm in that position, that poor mechanical position, and I'm doing something like clenching my teeth or chewing gum or eating carrots, something hard. I'm in that bad mechanical position and I'm doing something repetitively. So I've got kind of two strikes against me in that position. So of course I'm going to start feeling pain. So that's one position that is really bad for the jaw, that kind of looking down prolonged. Another one is that more of that kind of up position. Okay. Now this one is probably less likely for you to be in. Usually you would do that in combination with that kind of forward position, but I want you to try this too by itself, just looking up. So like this. If you bring your teeth together there, you're going to feel it mainly at the back, maybe even exclusively touching at the back. So again, that's changing your bite, that's changing your mechanics. Let's say you're eating or chewing gum or doing something like that in that position. That's really rough on your jaw, on the actual joint, and on those muscles. And you're going to start to have pain if you do that for a long period of time. So then I want to kind of, in a sense, combine those two into what's called forward head posture. So that's when people are kind of slouched forward and they're kind of leading with their chin. So more of this position, which we've all seen other people do, and I'm sure we've all caught ourselves doing it too. So when you're in that position, first off, the neck's in kind of a strained position here. Your head's forward, but your jaw in relation to the head is a little bit back or a little bit posterior. So you're going to get more of that contact on almost exclusively, again, those back teeth again. So same as with those other positions, that's going to affect your mechanics while you're doing something repetitively, like eating or something that's rough around the jaw, like chewing gum or maybe chewing licorice or something like that. So when people say, hey, it's really important to correct your posture, it's not just for your neck or your back. It's also super important for your jaw. I'm also going to do another video about some good exercises that you can do while you are in those positions, those like stationary positions like at a computer or driving, some exercises to do to get out of that. So check that out as well. Bye.